Welcome back. This week marks Canadian Fertility Awareness Week, and new research has found that Ontarians are encouragingly more informed about fertility planning than ever before. However, fertility myths and a need for continued provincial funding still persist. So joining us live now for more on this Wellness Wednesday is Dr. Michael Hartman from Generation Fertility. Dr. Hartman, thank you so much for joining us to talk about this. Let's start by looking at the latest data and research showing that Ontarians are more informed these days, and they're being proactive about their own health and future when it comes to fertility.
Yeah, I think it's truly amazing. I think we've come a really long way in the last number of decades where fertility was something that really wasn't talked about. And now it's something at the forefront of people's planning for their reproductive future. So the fact that couples are more informed, they're more willing to get evaluations, they're more willing to involve both partners instead of just assume it is a woman's problem. These are all things that really have made a huge difference in our ability to help people achieve a family.
Yeah, absolutely. So maybe you can give our viewers a sense of some of the myths, the biggest myths regarding fertility, and we can start with age and what kind of innovations are available today to help people reach their fertility goals.
Yeah, so unfortunately we still don't have a fountain of youth for eggs.
Right.
And that is our biggest issue, I would say, that presents today with women waiting longer to potentially try to conceive, whether it be that they're more career oriented or just aren't ready or keep saying there's always going to be a right time down the road. The truth is, there's never going to be a right time. It's never going to be perfect. And I'm always going to recommend that people get checked out sooner rather than later, just to be a little bit more proactive, even if it means potentially looking at preserving fertility, freezing eggs, freezing sperm, or just getting an evaluation for peace of mind and to give an idea of timelines, because age still is very much a factor when it comes to fertility planning. And ideally, we want to try to have people achieve their ideal family size. And the older a woman is primarily, it is associated with potentially requiring more aggressive treatments, and also the chance of success can also decrease. So it may require doing more attempts to achieve the desired result.
Yeah, so let's get specific about the age, because I was just telling you when the cameras were off about my sister and her partner. They're in their 40s and they're thinking, uh-oh, tick-tock, tick-tock, clock's ticking. Are there specific age ranges or categories for men and women when it comes to safe fertility?
Yeah. So, I mean, the term geriatric pregnancy has been used a lot, and I find it really insulting to a lot of women, in women 35 plus. And I think given that that's much more the norm now than it has ever been, number one, I don't like using that label, but at the same time, it does raise the importance of awareness, of the importance of not waiting too long for things to conceive, in order to conceive, because I do think the longer people try, they get the impression, or they may even be told by friends or even physicians, just keep trying and it'll happen. And the truth is that's not exactly the case. The longer someone tries, the more likely they are to need intervention. And I think that we know that 35, egg quality starts to decline. And at 37, that really starts to accelerate a lot more. By the time someone gets to 40, it is a lot more challenging, and there is a much greater likelihood of requiring assistance.
And what about for men? Because we look at Al Pacino, Robert De Niro, they're pumping out babies at like 70, so kind of unfair, right?
They certainly are, and you know, the idea of becoming a parent of a baby at that age is very intimidating.
Right.
In terms of research with male fertility, we do know that sperm quality is affected somewhat as men get older, not to as much of an extent as women, but we also know that there is a higher chance of autism and schizophrenia in males who conceive above the age of 40. So these are things that are important, and it is important to have those conversations and to think about, well, you know, if it's not happening in the near future, do I consider freezing some sperm? Do I consider just getting checked out to make sure everything's okay?
Yeah.
Some people may even want to have an evaluation before even starting to try to conceive, and that's becoming more and more common as people have become more educated.
Yeah. Dr. Hartman, unfortunately, we're running out of time, but I want to ask you this quickly about the cost and access of fertility. I know that various provinces do provide some funding. So in Ontario, what is covered in terms of fertility treatments? So
great question. And Ontario has been very generous for the last 10 years when it comes to fertility coverage, and the current government has committed to a lot more funding in the near future as well, which is really promising, and we're waiting for the details and very excited to be able to help more people. It's not as costly as people think. There certainly are costs, and as As we advance in terms of how aggressive the treatment will be, there will be increasing costs. Provincial funding does cover most of the costs of an IVF cycle, which otherwise may cost upwards of $20,000.
Wow.
And with employer benefits, as well as other sort of tax credits that have been introduced at the provincial level for fertility treatments, really there can be fairly minimal out-of-pocket costs for doing most things. And most of the evaluation is covered by OHIP. So it is something that I really feel like getting checked out sooner rather than later is important.
Okay, wise words and great advice. Dr. Michael Hartman, thank you so much for joining us this morning. Appreciate your time.
It's my pleasure.
Yeah,
Thanks for having me.
Okay, we're going to take a short break. Back with your headlines after this. Stay tuned.